Okay. All right. Well, guys, thank you for meeting with us at kind of a crazy time. Thanks for squeezing us in. It helps us out a lot. And I actually have executive session at 6 and then town council tonight at 7. So don't feel bad for me at all. But this will probably be the most fun meeting I have. I don't know. Maybe Kevin, you want to kind of start us off, or kind of everyone has the budget, so it is what it is.
Yes.
I was going to ask, is there a way to get this as the original Excel? Is that going to be posted on Govinda?
It will be on Govinda, yes.
Okay, thanks.
All right, the fiscal 26 budget, everyone got the rate sheets. Looked like rates were up about 12% on average over the current fiscal year. We did make a couple changes here in this budget. Tax levy portion of this budget has increased $776,700. The enterprise accounts also have gone up substantially, a little bit more than the tax levy portion. The reason behind that was we reduced the OPEB line item. We cut that in half from $1 million to $500,000. We also included a new budgeted line item for this year, the school lunch program. We're looking for the schools to pay their portion of the healthcare costs for the cafeteria workers in the amount of $107,644 is the estimate for next year. So on the town side, about 5.77% increase. The enterprise accounts went up on average, basically the overall average from the GIC from fiscal 25 to fiscal 26. But with that OPEB change, the total overall increase was $1,187,640, or about 7.46%. With that,
maybe Amy, did you want to add anything before we have any questions? Or
like you said, it is what it is, and it isn't what it isn't. No, I think I'll wait for questions.
Okay, I'm going to point out a couple of things, if that's okay, Dawn, before
Yes.
questions. That the health department, or the health insurance department, or the HR department, particularly Amy and Karen, have done a fabulous job over the years moving our employees into plans that were less costly, because in the GIC, as we know, there's a whole myriad of plans, and they've done a great job in doing that. And what happened was, most of the people, and you can see it from the breakdown of the plans, I guess that's on page 2 or 3, maybe 3, I guess. Most of the people have been put into, have gone for plans that have lower costs to the town. Unfortunately, this year, those were the plans that went up the highest at a percentage level across
Utilization.
from utilization. So although, but they are still the lowest of the mix. So, we will still be trying, or Amy and Karen will still be trying and working on moving people into the WellPoint plans, which is still lower. But that's kind of really where we go. But a good job there, really good job on the opt-out program. And I think, Dawn, since you retired, the whole healthcare system has fallen apart.
It has,
So
yes.
really, you need to, I'm blaming you. And I guess Dan had some comments.
I have questions if you're ready for questions.
Yeah, I guess so. Yep. If Dawn
right.
is, yep.
All right,
Yes.
so
Go ahead.
I guess my biggest questions has to do with this. I see on page 3, the current enrolled for the various plans and so forth. And I'm wondering, is the large increase in the enterprise funds and school lunch, is that directly related to the people and where they are in the plans? Or there's some other formula where we're shifting some costs to those other enterprise units? In other words, another way to put it, are the enterprise employees really the ones that are in the plans that are going up 17, 14%, or is something else happening? I'm just really curious as to how you're allocating to the enterprise funds, if somebody could explain that.
Dan, Amy, Dan, Kevin, Amy, maybe Kevin,
So
Liz.
I'll let Kevin jump in, but I will say one of the things that we looked at in budgets past was really fractioning down an individual plan to distribute it across the enterprise plans. So if we said we were going to add, 10 additional plans for this fiscal year, we were charging off just a fraction to the enterprise fund, when in reality, we have one opening in water sewer. We know that that opening is really going to cost $20,000. It's not going to cost a fraction of one enrollment. So there was a little bit of change in the formula.
So it's more closely tied to what the people are actually electing?
It's more closely tied to the actual number allocated for each, the actual number of bodies allocated for each division.
All right, so let me rephrase it. So if everybody in the sewer department was in the WellPoint total choice plan, everybody in sewer was in WellPoint, and they're going up 17%, I guess I would expect that the cost of the sewer would have gone up 17%. Or is it some other number?
We do work more with an average because there are so many plan changes throughout the year. People coming on or off or changing plans or whatnot. So it's really hard to allocate a one-to-one plan for the entire 12 months per person.
Yeah, I guess the reason I'm bringing this up is because there's such a large disparity between what the tax levy is going up versus what the enterprise funds are going up. 7.4 so is the total, but with the town's portion going up so much less than what do you got here? That 12 for the light department, almost 12 for water, and 13 for sewer. So, I mean, those are huge increases. And it begs the question is, are we unfairly loading the enterprise accounts, or are we making it more fair by recognizing that these guys should be higher to begin with? And that's the fundamental question I got.
I think it's a combination of both, Dan. That on page 2, you can see the reduction in the OPEB from $1 million down to 500,000 from 25 to 26. And then also, so that's on the OPEB line item, but then also on the additional subscriber line item, that's when those fraction of people were coming into effect last year. That you're not going to get 1/10 of a person in the water department. Either you're going to get a full body or a no body.
Right, right. So, okay, I see that with the light department, OPEB is down to 0. Is that because they're so well funded? They're better funded than the town. I know that.
They are better funded, and they fund theirs directly. It doesn't flow through this department, this budget.
Right.
So,
okay.
So they pay theirs directly. So that's why it's 0 here.
Yeah. So, okay. So for the light department, I think that makes a lot of sense. So why is water and sewer getting whacked as much as they are on the OPEB front?
I think that's the additional I'm sorry, on the OPEB front?
On the OPEB. What was OPEB for water and sewer last year? I guess I can bring it up.
I think it was double that amount. So it might have been 25,
26
or thereabouts. Yeah.
Yeah. So they took the same 50% cut. All right. I'm just worried about questions that are going to be asked about, why is the enterprise funds getting a 12+% increase and the town's only getting a 5 infraction. It
Yep.
just, begs a question, if you know what I mean.
Sorry, so is the OPEB, Dan, negatively impacting the budget or positively impacting the budget? How did?
Well, what it's doing is it's positively, because we cut it in half from $1 million down to $500,000. That helps our budget. Doesn't help our OPEB. And
No,
a
understood.
rating agency may look at this and say, "What are you guys doing?" And saying, they may have a negative impact or a negative outlook on Wakefield because we're cutting back on the OPEB front. When the OPEB is what really helped us push over to AAA.
No, I know, because we were 1.4 a few years ago, 1 million for a few years, and now a half.
Now we're down to a half. Yeah. And by the way, we're not alone. A couple of my other clients have also cut back on the OPEB because they're getting squeezed in other areas. And OPEB's a convenient spot to make some cuts, similar to what we did years ago in capital. Many years ago, capital got cut down to a couple $100,000 because it's an easy spot. There's no quote pain that's obvious, like cutting individuals or programs or anything like that. It becomes a low-hanging fruit for cuts, but it has consequences down the road, of course.
No, understood. So just the additional subscribers, did you explain that, Amy? Is it a portion, did you say, or something like that? I'm sorry.
We did an average with a number of bodies, right, Karen? We went back and forth on this so many times, I'm sorry. We did an average per person cost with a number of bodies. So when we compare this year to the prior year, we added 19 subscribers in the past year. And although we are on pace this year for our scheduled budget, I'm concerned with moving forward, given the number of positions being eliminated, layoffs, et cetera. If we, in a normal year last year, added 19 bodies, and this year could be potentially double that, 40 additional plans is significant. And if in the event we are adding plans because of a spouse who loses coverage, you're guaranteed it's a family plan because it's a spouse losing coverage. So we're looking at an average, I want to say, of like $22,556 for a family plan.
No, understood.
Yeah.
All right, I have a
quite
few more
unknown.
questions, but I'll wait. I don't know if others had questions.
I do have a question, also on, I believe it's page 3. I'm looking at the retiree plans. And when you look at the FY25 average cost per enrollment, I'm trying to understand why the average cost per enrollment for retiree plans is so high. I would expect those would be lower, because aren't the premiums lower for the retirees?
The premiums are lower for the Medicare plans, but we do have retirees on non-Medicare plans, and that's where the expense is. You're absolutely right. The Medicare supplement plans are very inexpensive. However, not everybody retires at 65, and not everybody is eligible for Medicare. So we do have quite a few aging teachers who never paid into Social Security, will never be eligible for Medicare, and they're on non-Medicare plans. And those people who are not yet 65, who are newer retirees, have non-Medicare plans. And particularly if you're under 65 and you move out of state, that's the highest cost plan, which is is that the Access America? It's
Yes.
the Access America plan, which is $28,000.
Well, speaking of Access America, so what type of plan is that? It's not an HMO, it's not a PPO. What is that thing?
It's a national indemnity, Karen.
Indemnity?
It's not indemnity. I don't know what they call it. It's a national plan. Karen's looking. A PPO. It is a
It's a
PPO.
PPO provider network, yeah.
PPO, yeah.
Yeah, because I noticed that on the comparison between 25 and 26, it was blank, and I'm going, okay, so what kind of plan is it?
Yeah.
So did you just say, Amy, that a teacher, can you just explain what you said about a teacher? So they don't put in, so they don't get it. Just, can you restate that, please?
Sure. So our average employee, they're 65, they retire, they go on Medicare as their primary insurance, and then they just buy a supplement through us, which
Right.
covers things that Medicare doesn't cover, and it gives them prescription coverage. There is an older population of teachers who never paid into Social Security. So they're 65 and they retire. They don't qualify for Medicare ever. So they stay on the non-Medicare plan. So you're looking at like the Harvard Pilgrim Quality or the WellPoint Community Choice or the WellPoint Plus. So you're looking at a much higher cost. You know, the supplement plans are maybe $400 a person, $300 or $400 a person on the town's cost. And the individual plans for the non-Medicare plans, those are like $1,200 a month per person.
Yeah, and you could also get some non-teachers that don't qualify.
It's
So, yeah,
rare,
so,
but
yeah,
yes.
yeah. If somebody is hired before 1987, February of 87, something like that,
Yeah.
yeah, they wouldn't be qualified for Medicare.
Yeah, so part of their retirement package is they're eligible for insurance, and that's what you're referring to.
Right. But as they age out, that will become less and less.
Right.
And then we'll just be left with those group of people who retire before 65, who
Right.
can't yet go on Medicare.
And are any of these plans, none of these plans, I assume, have a deductible, or do they? Not that that matters, but I was just curious.
They do all have a deductible. Both Medicare and non-Medicare plans have deductible.
Great, okay.
So is it safe to say that the bottom three of the retirement plans are the Medicare eligible employees, and then the top ones are non-Medicare eligible?
Are you on, which page are you on?
Page 3.
Oh, so it's page 5, that's why it doesn't make sense. So yes, the top half of this are active employees and the bottom half are retirees. So you can see how many retirees are on non-Medicare plans. The only Medicare plans are the bottom 3.
3, correct. Okay.
Yes.
So
And
we-
the opt-out seems like it's doing as expected. I mean, $890,000 in savings in 25, right? 64 people or families or whatever.
The
Yes.
opt-out is doing very well. In this fiscal year, we were able to negotiate with the PEC an increase to those payments. So the individual plan went from $1,500 a year to $2,100 a year. And if you drop a family plan, it went from $3,000 to $4,200. And that was really to keep pace with the increased cost of premiums. People were coming in to compare their spouse's plan to our plans, and our plans were becoming more attractive as the premiums for the outside plans kept creeping up. So it was warranted, it worked. And I have to say, I am an opt-out, and I know that our GIC insurance is better than the insurance that I have. But once you come off, it's near impossible to come back on. It's not financially reasonable to come back on. Only in the event that a spouse loses coverage is it really financially, it's necessary. It never makes financial sense for the employee to come back on once they opt out.
So I have a question on retiree plans. You mentioned those 3. The GIC Act offers 4. Health New England Med Plus is not on our list. Can you explain why that is?
It's the
Yes.
western part of the state, I think.
Yes, we don't have any subscribers. We've never had any subscribers. It is specific to care in the Worcester area,
Okay, that'll do it.
In the last page is the, you do, it's a co-sharing, right? 80% or 75%. I think it was a total cost, and then you have town cost and employee costs. So there's a sharing
So
component, obviously.
Karen put together this comparison between FY 26 and FY 25.
It's monthly.
Monthly, yes.
Right.
And the HMO plans are a 80-20 split, with the town covering 80% of the premium. And the indemnity and PPO are a 75-25 split, with the town paying 75%.
So, we negotiate those percentages.
Yes.
Any discussion yet about increasing the employee share?
Well, we have a meeting this week. I'll be discussing it, but we have an agreement through, I think it's fiscal 27, if I'm not mistaken.
Yes.
It's something that, we can talk about with them. I sense that's why that the president wants to come in and see me ahead of time. Because all the employees meet together.
Yeah,
Yeah.
I
It
just said,
never goes well. They always want it to be a less of a percentage.
yeah, I'm getting some noise from my clients who are talking about, these increases. Are thinking that maybe they need to increase the percentage for the employees and retirees. So that's on the table in some communities.
Karen just fielded a call right before this one from Weymouth. They're at a 17% employee share.
Waltham, I think, is 5 and 10.
Wow.
No.
Yeah.
Well, I will tell you that when I have breakfast with my parents every Friday morning, they say, don't touch the retiree share.
Yeah.
As I walk out the door.
Yeah, surprise.
So Dan, I know, in your spreadsheet, you had a number in there, and this is a much bigger number. Did you recall what we were carrying, so to speak?
Yeah, this increased about a little over $400,000.
From your projection from early on?
Yeah.
But you adjusted it last week when we got this, right?
Yeah, I moved it up. So the last Excel
Yeah.
spreadsheet forecast I sent up, but the one prior to that was like 1955 shortfall, and now it's like 23 and change. So it's about 400,000, I think.
Very good. Yep.
And then the other question, of course, is moving forward. I mean, obviously this is going to be a big hit, but are we going to get another one in 27? That's obviously yet to be determined, but right now I think I've got a 4 or 4.5% assumption for 27. And, reading between the tea leaves, I suspect that might be too low. I would guess that we're going to get a big increase, maybe not 17 and 14% like we got now, but I'm going to guess that it might be close to 10 next year, 27.
I tell you, it really was surprising to me that the GIC really didn't do any plan design changes that might have helped bring the premium percentage down.
Right. And historically, you've done really well on the increases, right?
Oh, yeah.
Generally speaking.
Oh, yeah.
2%, 3%. I forget the numbers, but
No, you're right. About 2 or 3%. It's actually right. Yeah.
yeah. And
And
so
we started at a lower number. We jumped
Right.
up, we dropped down from where we were. It's been a great program for 15, 16, 17 years. This is just,
and it's still the most cost-effective program, right? Given other choices, I presume.
I think so. From what we're hearing from other communities, yes.
It is, yeah.
Yeah, Maya's had some big increases. They're not a good spot.
Yeah, I mean, I pay a family plan 1,500. I pay 2,563 For a 2,500 deductible, I pay 2,350, small business. You know,
Oh,
30,
small
Harvard,
business.
Harvard Pilgrim with the, you know, deductible. So, you know, I was comparing the numbers and that was a family plan, obviously. So, yeah, you know, the change was 4.22 this year. It was, 9 the year before and 0 the year before that. It's just very erratic.
Very erratic.
So not much else that can be done, Steve,
Right.
other than, do you think some of the municipalities will be pushing for GIC to give consideration for other plans, more cost-effective ones, if they exist?
I think that the communities that I've spoken to were kind of in shock about this, felt there would be plan design changes. I think we get that the premiums went up, but there could have been some changes. So I think there's going to be a hue and cry for this. You know, this on top of a anemic state aid number is kind of a tough double whammy for us. But
And
we're in the
GIC
same
has
boat
been
as everybody
talking
else.
about the plan design changes for years. They know
Yeah.
that there's been a call for it. They
Right.
just haven't pulled the trigger.
So Kevin, what is your guess, you know, with the health, this particular budget has returned significant funds back to general account over the last several years. The current budget in front of us is 17.1 million. How much of that realistic do you think might be coming back for 26? A small piece, a little bit, none?
In 26 of this current fiscal year.
26.
Next year,
Yeah. Do you think zero?
I'm hoping that we make the budget next year. We don't
Yes,
have to do a supplement to it. That,
Okay, well, that is an answer. What about
So- so-
this year?
For the current fiscal year, I'd probably look in the vicinity of between maybe 2 to 300, somewhere
Okay.
in that ballpark.
Yeah, much less than 24.
Right. So probably like $1 million less than last year.
Yeah, yeah. So 26 could be a zero or a negative.
Correct.
Yeah, okay. I'm not going to disagree with you.
My question was in the health insurance opt-out program, so we've got one, you know, basically 200,000 pegged for next year. What are we running this year? How does that compare?
I'm sorry, what was the question?
On the health insurance opt-out program? So we're budgeting 199,500 for the opt-out program. I don't know how many employees that is. What's the cost this year for the opt-out program and number of employees, and how does that compare?
Karen's pulling that number right now. So I know that we have 64 on the plan. I know we have 64 on the plan presently. And we are at,
Is that what we're budgeting for next year also, or?
well, I'm hoping that we have more than that next year.
What is the 199 based on? Is it based on more or is it based on 64?
Hang on just one thing.
I think the thing to remember,
It's
if that budget line jumps up, Dawn, that means another budget line came down way more.
Comes down? Yeah.
Oh,
Yes.
on the premium. So that's,
Yep.
I hope we exceed that.
Yep.
That line. That's a good thing.
So it is based on the 64.
Okay.
And then obviously these premiums went up, so the co-sharing goes up as well, right, Amy? The cost of the employees,
Yes.
Yes.
still the same percentage split. Yep.
Yes.
And what are the additional subscribers?
The additional subscribers are planning for the unplanned enrollments. So open positions, qualifying events, if somebody gets married or has a baby or
Spouse gets laid
spouse
off.
gets laid off.
Okay.
We also have, we've also considered that our DPW had a near 50% turnover in the past couple of years. And they hired a lot of staff that were under 26. So we're expecting quite a few to be aging in.
You think this increase substantial enough to have people reconsider opting out? Think it'll help that side of it?
People are always interested in opting out. It's just the part about getting in front of them and getting them to understand. Sometimes the person that we speak to isn't necessarily the one who deals with health insurance in their household. We try to get spouses involved, bring anybody you want, whoever manages the insurance in your household, we want to talk to them. But I don't know, you probably understand. I deal with that in my household. My husband doesn't deal with it at all, yet he's the subscriber. So of course, when they mention anything to him, he calls me and says, what do I do?
Right.
So I think that's part of it. And just doing the simple math. One thing I have to thank you so incredibly much for having us be able to get a coordinator this year, because it has really allowed us to get out in front of different groups. Karen's been in front of police, fire, DPW. She's already been there in the fall trying to talk about opt-out to prepare them for open enrollment. We're working with the communications director on a communication strategy that we implemented in the fall that's phased out to lead up to open enrollment, which will be happening in just a few weeks. So that is our greatest space for creating change. We talk about it every year that the pool for right sizing people into plans is just getting more and more squeezed. I think last year in a pie chart I showed you, it was probably 75% were already in plans where we needed them to be. A portion of those people, the 25 remaining, need to be on the plans they are for where they are and where they live. And then there's maybe another 10 to 15% that we might be able to get to switch, but opt-out is our primary focus going into open enrollment this year. And like I said, once you change, it's really hard to come back. It just doesn't make sense financially.
Why do you say that? I'm sorry. So
the town pays me to not take the insurance.
right,
So
understood.
I get that every month. It's $350 in my check. So if I were to come onto our insurance, I would not only lose the $350, but then I would take on a $450 family premium per month and have out-of-pocket costs on top of that. So the $4,000 that I'm getting goes away, and then I'm taking on another $4,500 to $5,000 in premiums. So the delta is huge in that.
Obviously, your spouse is gaining that. Anyway, I understand what you said. Yep.
Well, so you're losing the offset, the $350 offset that you can pay to whatever premium that your spouse has.
Right.
So that makes sense. So, and Amy, you kind of addressed that it was going to be my other question. I don't know if it'll come up at the council this year, but they had questions about the new position that we added last year. And I just wanted to check in to see, if we felt we were getting full utilization, if there were benefits derived from that position, and how that has gone.
So we were able to hire somebody. She came on in July with us. We found somebody unique in that they came from another municipality. So she had GIC experience. She had experience with our same workers' comp vendor, unemployment vendor. The vendors were near identical. So that part was seamless. So she's allowed us to do any number of things. First and foremost, like I said, Karen's face-to-face in front of people. That piece where we are two working people in addition to strategizing and creating programs, she's alleviated that piece. She's doing a lot of the billing for Karen so that it's freed up quite a bit of her time. We also have achieved economies in workers' compensation. I understand that's not in my budget, but we do manage all of the claims. And she's been super proactive about closing out the claims a lot faster than they had been in the past. So I want to say in July, we were paying, I have it right here. In July, we were paying $3,931 a week in workers' compensation benefits. Now, this month, we're paying $1,495 because she's been able to force closure on some of those claims, which has been unbelievable. It requires an enormous amount of babysitting,
Yeah.
and that's been very helpful. She's also been effective in the unemployment space, which again is another item that's not in our budget, but I think there were a lot of loose ends in process and administration that kind of left us on the hook for unemployment a lot of times. So we've worked in conjunction with the schools. The majority of our unemployment is, the claims are with the schools. And we've had great success in creating some processes and implementing some different forms and structures so that everything is very well documented, so the instance of eligibility is lowered.
We're
And
self-insured for unemployment, is that right?
Yes,
Yes.
yes.
So do we have a firm that challenges folks who, and all of that? So, yeah,
we do,
Yes.
we do,
Yeah.
but without proper documentation, there isn't.
correct.
And the other area where it's been really helpful is, we kind of own the capital item from last year, that time and attendance software that was approved through the budget. That implementation is coming through this office and probably consumes anywhere from 1 to 2 days per week. So she's been helpful in offsetting that time so that Karen and I can really dedicate the time to implementing that. And the time and attendance, it's so important because our processes and our HRIS system here, it was set up in 2010 in just a very elementary way, and we don't use any of the features. Much of what we do in this big, robust software solution we have is hand entered. So as you can imagine, with hand entries, there are any number of errors. And without all of the departments on the same page, the contracts are administered differently by every department, none of which is contractually proper according to the contract. So even just in standardizing some simple things, Steve has been so helpful in helping me beat the drum of salary scales and tables. So as we've been negotiating this year, we're establishing salary tables right inside of Munis. So when you say somebody is a C9 step 4, you just put in C9 step 4 and it attributes all the same rates. It does all of the calculations. In the past, we'd done everything in Excel, and Excel doesn't do the best calculations. And it's been incredible. It's an incredible amount of time to get these things implemented, but very much well worth the investment. So thank you very much for your support with having us add the HR coordinator.
Okay. And I think my last question was, we mentioned the school lunch program broken out here. And is that supported through the revolving fund? And do we have a revenue offset from the revolving fund to cover these expenses?
KG?
This is funded through the school lunch account, and this is a breakout for the cafeteria workers that receive health insurance benefits. So
Okay.
this is the portion attributable to them.
And are
And when
we,
you say a revenue offset, this would be the revenue offset to this budget from the school lunch program. That 107,644 for next year.
so the school's going to transfer to the to the general fund,
insurance.
107,000 to
That
the health
amount.
insurance to cover this amount.
Correct.
Okay.
Yes.
think Ellie had a question, Dawn.
Yeah,
Oh, okay.
it was just around the employee contribution, so it's 2025, but is there any bargaining units that have language in terms of percentage increases that are capped, right? So I've seen agreements where it says it's 20 or 25%, but if health insurance, say, goes up a certain percentage, it gets capped. Are there any, there's no language in any of the agreements that has anything like that, right?
Not that I know of,
Not that we
not on
know
my
of.
side,
right.
yeah.
Wonderful. Okay, that's good news.
Ellie, you found the one piece of good news in the whole thing. Dawn, the town council will hear this on May 24th. Are you available? March 24th, I'm sorry.
I see.
March
Okay.
24th.
Yeah, May
Don't rush
20,
us,
May
Steve.
24th is a little late.
I'm pushing the calendar forward, Dan, I'm sorry.
Jeez.
Sure, yes.
Okay. And then FinCom will hear it on the March 27th, I believe.
Okay.
Those correct, Kevin?
That sounds right.
That's correct.
Okay. Perfect.
By the way, I'm gonna get a quick correction on the impact on my forecast. This is going to increase, it increased my forecast deficit about 300,000, not 400,000.
See, we're
Yeah.
getting better all the time.
Yeah, what percentage you have in there?
Oh, we're going forward?
No, for 26. Was it 3%?
No, it wasn't 3%. Hang on just a quick second. I've got the spreadsheet up. Just have to get the right tab. Healthcare, medical. I had 4%.
Okay.
4%.
Okay.
And I'm rethinking that 4% for 27 now. I think it might have to be higher.
I would think so.
How bad do I want to make this?
And Steve, we're comfortable with the drop in OPEB contribution, that's not going to impact our bond rating and
Well,
No,
borrowing negotiations?
well,
no,
I think
no, and 1,000 times no.
Yeah, and I don't know if that was pretty completely
it's-
advertised to all, but go ahead.
it's the lesser of other evils, maybe. I
Good
think-
discussion for Thursday.
Yeah, good discussion for Thursday, but it is the lesser of other evils, I think.
Yeah, do we have any schools on the horizon beyond the high school? Where we have to go out for a bond? I mean, that's the key.
Yeah,
I mean,
no, I
what-
mean, not in the near future, I don't think. I mean, I think we'll do, well, there's always something, right? There's a DPW garage, there's the
Greenwood,
there are things, yeah.
there's things out there, and obviously to drop from AAA to something else is going to cost us a bunch of money.
No, there's no doubt about it. Using 2.2 of free cash isn't going to help the math either, Dan, as you know.
Yeah.
I think I'm good. Steve, can you call me after the meeting, completely unrelated? Oh, you
Can
got to check
I have
out.
I have a 6 o'clock town council meeting.
I'll talk to you tomorrow.
Okay, thank you. Sorry.
No worries. I'm good, thanks.
Okay, Steve, I think we're good.
Thank you. Thank you guys very
So-
much. Have a great.
All right, I'll make a
Amy and
motion.
Karen, thank you.
Thank
make
you
a
all very
motion.
much.
I'll make a motion to adjourn at 5:46.
Second.
In favor? Aye.
All right,
Thank you, guys.
thanks,